in terms to help to improve the healthcare systems, but also it poses quite a lot of risk and challenges. And also how, in terms of opportunity, the digitalization and this innovation could help us to deal with this digital divide that we have, not only big cities, but also, of course, in more significant way in big cities and informal places. That is one of the topic of main research of the City Science network. That is how we deal to redesign or in these non-formal places in cities. So these are a little bit to risk and one opportunity that we think and that we wanted to discuss. And also the other one was more related to how we engage patients, doctors, the different stakeholders in this new paradigm about digitalization and innovation in the healthcare system. I think the other one will leave it today. So maybe if you want, you can send us in the chat some questions for the speakers first, if you want, and we will start to deal with the different speakers. Stop sharing. I don't know. No question in the audience?
Marcus wants to say something, I think. Marcus.
Yeah, I have a question. Thank you very much, everyone, about kind of a unified platform. Is there an emerging platform that would allow kind of the integration of a lot of different data sources, to kind of be overlaid? I think that's one of the biggest challenges that I'm seeing in healthcare systems, where there's a lot of data collected on multiple venues, but there's very little way of correlating it to find emergent, phenomenon or whatever in populations. And I'm wondering if you guys see that there's a strong trend that one should just kind of start looking at in the industry. Thank you.
It's me for that.
I think so. That would be, I know that between your work and Ronan's work, Ronan was working with telecom data, which is one, but that was overlaying that with other, findings from testing. But
the silo, in healthcare, we're still in the silo era. Although obviously we could say Paleolithic or silo era. Maybe in the future they will look back to us saying that was the silo era, because there's a lot of blah blah blah. But at the end, the typical data lake that in other industries you would say, okay, have here that data lake with all this data. At least in Europe, for obvious reasons, for GDPR, for many other obstacles, for the typical silo structure, you have a hospital in front of another. They don't share the obviously the electronic health record. Governments have done step forward, integrating things with good interoperability, but sometimes what you have integrated is a minimal database, that it's not the huge data lake that you could have. So in that sense, it's a huge potentiality in healthcare. At least in Europe, we will have to be very innovative to bypass regulations. And I foresee that, for example, what it's called more collective intelligence, because there's artificial intelligence, but then of course, you have, at the end of the day, still data. If you transform that in a vectorial, what is called knowledge, then regulation allows to share knowledge between institutions, no? So right. There's some nice technologies that it's called collective intelligence, that we're doing is transforming this data in vectorial knowledge, that I see a huge potential, because until now politicians have not thought of regulation to stop that. No, I would stop here in that sense.
Yeah. So that's a little bit about the experience, Jordi, that we, in fact, is one of the topics that we have at the decided project that really go to this digitalization, or to really create this digital data platform to improve the city digital health. And one of the topics was with Jordi and some colleagues, okay, is there any platform, is there any standard that we could start to build it? And what we found is, not in Europe and everywhere, we found that most of the healthcare systems are still in closed lock infrastructures and software tools, that they are not thought about this philosophy. They are at a closed health record system and so on. And that we really thought that we are still in a point that we still have to decide how really can open these closed systems in an open way to really make these connections to the citizens, to the EI, so on. And this is what we found here, but doing a benchmark and talking with a lot of people, it's more or less the point that many hospitals and many places are. Some of them are a little bit more ahead, that they already have this kind of middleware, converting what is the medical history records to a way that you can explore, play, and go further. But yeah, this is, I think, one point, at least in our environment, that still in this point of try to talk everyone in the same language, in the same standards. And also I would add that we are still in the point that we have still to define several standards in terms of how we deal with personal data, how we deal with the identity of the people going to how is the owner, the hospital, the citizen. So I think still there are many questions yet in order to have a really standard, not even platform, but still standard of how we build platforms, that I think that for sure the context that we are in terms of the pandemic and crisis will accelerate to look for this kind of standards that would help us to build these kind of platforms, for sure.
Right. It seems to me like if we can define metrics that are relevant, that would make it easy to create these kind of vectors of information, so that you could extract at the database, whoever's collecting it, the useful information that then could be put into a larger civic data pool. And that, I think, would be an interesting challenge.
The problem is that there's still poor amount of data. Many data has not been collected correctly, and a lot of data put by patients in the last year would overpass the current data. No, and I'm asthmatic. If I go once a year to see my pneumologist, he would know me once a day. But if I send my data where I have been walking with the ozone, with the NO2 of the that's an example, no? So it will change totally. But right now, hospitals and governments are starting to listen to that, and very soon it will change everything. Eh? It will change everything. So
I would like to talk about it because my previous job, I was designing bike infrastructures for the Barcelona City Council. And we face the opportunity to collect a lot of data, how the people is moving here in the city. But I mentioned Barcelona, but I know that I'm totally sure that is happening in many cities worldwide, that the municipalities do not have the capacity to manage this amount of data, neither the technology. Probably they have the intention or the idea to work with all this data, but most of the times they don't have the technical, neither the political capacities to manage all the data. So there is not only technological issues here, but very human resources issue to talk about it here.
We have one question that I read it actually. Is what about privately collected data from companies? For example, I have constantly recording AKG. implanted inside of me. Medtronic owns it. So every night they upload the data from each of my heartbeats to their cloud. Cloud governments or institutions gather data anonymously so that the one could add the data to see things like an increase of heart rate over time can demonstrate a fever in a patient or gather data in fighting COVID. Is it possible to combine private patient data with public through anonymization? Yeah, that's exactly one of the points that we wanted to raise in this discussion, is about how we'll deal or how we tackle with this balance with privacy of data, but is shared to the collective knowledge for the systems or for the healthcare environment.
And also there are different regulations. The regulation here in Europe is different than in other countries or the United States. So sometimes the data belongs, well, Jordi, he can add information about this, but sometimes the data belongs to the people who are developing the medical device. And in other regulations, that's not like this. It's your own data, and then they don't have the rights to share, to do things with them without asking you. So this is a big challenge, of course. So.
No,